Hello, everybody. We're going to start. So please take a seat if you're not already sitting down. All right. So welcome to this concurrent session on providing mental health services to Black people. We're going to begin with our first presentation from the Black Health Alliance. We're going to have 15-minute presentations and a question period, either in between the presentations or at the end. So I'll let the first presenters take it away.
Thank you so much. Good morning, everyone. Bon matin. My name is Tiyondah Fante-Coleman, and I am a researcher at Black Health Alliance. And I am also a PhD candidate at the University of Toronto. And today I'm going to be presenting the results from a paper that I co-wrote with my colleagues Muna and Shekina. And the paper is called Seeing Both Sides, Detailing the Experiences of Black Women Mental Health Care Workers Serving Black Youth. And before I continue, I'm going to give space for Shekina and Muna to introduce themselves.
Hi, everyone. My name's Shekina. I'm a research assistant with the Center of Addiction and Mental Health in Toronto.
Hello, everyone. It's great to be here. My name's Muna, and I'm a medical student from the University of Manitoba.
Great. So just to kind of get us situated, today we're going to be talking about the experiences of Black women mental health care workers who work in the mainstream mental health care sector. So that's organizations that are not necessarily Black focused, specifically in Ontario. And we're also going to be identifying how Black women mental health care workers are positioned within their working environments. We're going to link the current state of the profession to the impacts on Black women mental health care workers and Black youth, as well as provide tangible solutions at the end. So the reason that we decided to co-write this paper was that post-George Floyd, mental health care organizations in Canada have really recognized that there was a need to improve mental health care provision for Black youth. One of the common solutions to do so was to provide racially concordant care, where the race of the mental health care provider also matched the race of the Black youth seeking care. However, we also knew that the reason that was so successful was that Black women mental health care workers really inhabited a very unique position within the sector. They were professionals who had clinical care experience, but they were also Black people with experiences of Blackness and anti-Black racism within their communities. And so it was really important for us to, one, recognize that there was a need to do this, but also to understand that there was a need to understand the unique experiences and challenges of Black mental health care workers and what they face in their workplaces as it relates to sexism, racism, as well as colonialism. So the results of this paper are really drawn from a larger study called Pathways to Care. And that was a 5-year systems change project that really aimed to improve access to mental health care services for Black children, youth, and their families across the province of Ontario. And so the goal of the project was really to understand how anti-Black racism affected access to care, to provide tangible solutions to address anti-Black racism within the mental health care sector for Black youth, and to underscore what steps were needed to be taken to improve the mental health care system for these young clients. And so that project really was drawn and leveraged 3 different kinds of research activities. The first was a scoping review just on access to mental health care for Black children and youth. The second was focus groups, which is what the paper is actually drawn on, the results of this paper. And the last is a social network analysis survey that actually my colleague Mel presented on yesterday. And so the results of this paper are really drawn from a theory that we kind of co-created together called Black sisterhood in Canada. And it's a direct adaptation of a theory called Africanist sisterhood in Great Britain. So that theory was really based on experiences of Blackness within the UK. And this theory is really focused on the experiences of Blackness within Canada. We're also leveraging intersectionality in our analysis. And so the results of this paper really focused on a social justice frame, looking at historical context, the intersectionality of Blackness in Canada specifically, as well as feminism with an asterisk, because we're looking at Black feminism here. And so this theory really provided us a lens to see through the information that we were kind of looking through when we were talking about the focus group results. But it also helped us to understand this like dual experience of hypervisibility and invisibility that Black women experience within the mainstream mental health care sector. So in some instances, they're super visible, they're really put on a pedestal to do a lot of work, but then in other instances, their experiences were invisibilized.
So for our methods, we conducted interviews across 23 focus groups throughout Ontario. And of those focus groups, we had 128 participants. And the participants were Black youth, family, and community mental health service workers. And having these conversations really allowed us to get like a well-rounded view of the mental health profession landscape in the province.
In addition to the other participants, as Shekina mentioned, there were 35 service providers that were engaged for the Pathways to Care project, and 24 of them were Black people. The majority of service providers identified as women, with 28 being women and 4 being men. And Black women represented 62.9% of all participants. And while this study did look at service providers of other ethnicities and races, it focused mostly on Black women.
So the results of this study are only drawn from the experiences of Black women in the sample. And so when we talk about our results and what we saw when we went back and looked into the data, was that there were 3 major themes that participants talked about. The first was that Black women were often working in a toxic work environment, and they often described that their workplaces were unsafe for them. As well, Black women were often witnesses to instances of anti-Black racism that was directed at themselves, at their colleagues, and at Black youth. The second theme was Black women taking on multiple roles. And so Black women often described having to fill in the gaps within their mainstream organizations, particularly as it related to the care provided to Black children and youth, needing to become visible diversity, equity, and inclusion leaders within their organizations, and also having to do a lot of the hard work and then exiting those organizations. And so that relates to our last theme, which is impact on the profession. And so really what our participants found was that, the system was really discriminatory to them, not just within their specific organizations, but across the system as a whole. Black women often talked about leaving the profession, and we have a few themes as relates to that. But then also they identified support for their colleagues, support for themselves as a form of resistance.
So with the first theme being a toxic work environment, 2 sub-themes emerged. The first was workplaces are unsafe, and mental health care is seen as feminized work. And so when this intersects with racism, for the Black women, they experienced gendered experiences of toxicity, which took the forms of sexual harassment and fetishization in the workplace. And Black women encountered racist sexual harassment, which was further aggravated by the inaction of their superiors. And so there was lack of an appropriate response from their organizations. And so when they would speak out, they would be their complaints would be disregarded or penalized. Am I going to the next? And so if you look on the left, Lana says that higher ups would tell her, oh, you got this comment from someone. Do you think it was a misunderstanding or this person was just interested in you? And so she felt that a lot of it was racial targeting towards her in the workplace with these comments. And for the second sub-theme of Black women as witnesses, when Black women witness racist policies in their organization, again, there is this lack of appropriate managerial and organization responses. And so perhaps you have a coworker who has said something racist and or sexist to you in the workplace, and they're being suspended with pay, or there is no accountability. And this was a common experience. And Black women are also often witnesses to racial discrimination of staff and their clients being Black youth in the workplace, and they constantly had to advocate for them, which took a toll on them. Oh, yes. And so the second sub-theme here is Black women as witness. So Lana also says that having to point out the Black staff struggles and being the one that had to constantly advocate for Black people that were coming into her organization.
So the second theme was Black women taking on multiple roles. And so participants often talked about the fact that they felt that they were often obligated to take on these additional work within their roles within the mainstream organizations. And so the reason that this was because Black women's identities often positioned themselves as being the people who felt that they need to help. They had the clinical expertise to know that, Black youth weren't necessarily being served properly, but then they also had their personal experiences of being, on the recipient end of anti-Black racism. And so they felt that they really needed to intervene in these instances. They couldn't just kind of leave them as they were. Unfortunately, that led to a lot of additional work for these women in these organizations that went over and beyond their responsibilities. And so even though they felt compelled to address the effects of anti-Black racism as it affected youth within care, this really had a profound effect on them. And it was often in response to the fact that there was a leadership vacuum within their organizations. Organizations weren't taking the proactive steps to actually address anti-Black racism. And so Black women felt that they had to step up and fill in that gap. On the flip side, Black women also described being expected to lead the diversity, equity, and inclusion efforts within their respective organizations. This was something that was expected of them because of the identities that they held, but it was also something that, they were kind of, if they would point out that something was wrong, it was, well, you be the solution, then you solve the problem, rather than organizations being proactive. And so Black women often did a lot of this work. And I should mention the context of the study happened between 2020 and 2021. And so Black women were really penalized at the same time for doing this work. So they were either doing it out of the goodness of their own hearts, they were being told, voluntold to do this. And then when they were pointing out, instances of racism or policies and practices that should be changed or things that are occurring within their workplace, they were often penalized professionally for the fact that they were doing things that they were either told to do or felt obligated to do. And so you can see that in these two quotes. So the first one is from Sharon in Hamilton. And she kind of talked about the fact that, that there was a lot of gaps and things that she noticed within her organization when she was leading a lot of the diversity, equity, and inclusion efforts. And so she noticed and noted that she felt that a lot of people were also becoming DEI experts in their organizations for free. This was on top of the role and the responsibilities that they already had. And this was largely because organizations really didn't recognize that anti-Black racism needed to be addressed until George Floyd happened and the racial reckoning happened. And so a lot of these people were put into positions quite quickly. On the flip side, Lexis was talking about the fact that she'd been doing diversity, equity, inclusion work for over 5 years within her organization, but that this was not an official role that she held. This was something that was expected of her as a manager because she was Black, not for any other reason. She wasn't paid more for this additional labor. She wasn't, given a reduced workload for this additional labor. She was just expected to do it because of the identity that she held.
So with the impact on the profession, there was 4 key points that came about from our project. And we noticed that lack of Black representation and support is really impacting the profession. A lot of these mental health workers are working hard. It leads to burnout, and they're either deciding to leave the profession completely, or they go to Black-owned private practices in search of fulfillment and workplace solidarity. Then the second point we notice is anti-Black racism, and in particular, systemic and societal issues was impacting the profession. And it was causing feelings for, pardon me, it was causing a lot of feelings of prolonged imposter syndrome and educational inadequacy for a lot of these mental health workers. Then third, vicarious trauma was then compounding all of these challenges that the mental health workers are experiencing. But then on the flip side, some of these mental health workers turned that lack of support into a form of resistance through highlighting how the system is failing and working towards pushing for better treatment for Black people in the community. So there's a couple quotes here. The one on the left, Lana from Ottawa. You can see she highlights here that the lack of support in her workplace, in particular with necessary managerial debriefs and counselor care, was not provided to her. And when she went and sought help, she felt like she was being a burden. And it's those factors which ultimately led her to leave the profession. Then on the flip side, Miranda from Kitchener-Waterloo, who had the support, she was able to open her own private practice. And among that, she was able to offer herself more and really put her heart into her work. And as a form of that, she sees her practice as a resistance where she can then be providing quality care to the Black community and the people she serves and help people that share her background, as well as increase Black representation among her practice.
So some of the takeaways from our study were that Black women are overly burdened with the responsibility of caring for Black youth in a system that is ultimately failing to meet their needs. So they are providing individual solutions to a system-wide problem. We know that Black women are also subject to racialized sexual harassment from their peers that often goes unaddressed by their leadership within mainstream organizations. Despite this, Black women are also expected to fill the leadership vacuums within these organizations and having to do the additional work to make sure that Black youth are accessing safe care. In Canada, we know that, Canada is often a colorblind country, but this colorblindness often led to white professionals stripping Black women of their experiences, especially when they were complaining about being on the receiving end of sexual harassment, and representing or distorting their experiences and what they're saying to make it more palatable for them to understand. So instead of saying that this happened to you and this is why, maybe you didn't experience it that way, maybe that's not what that person meant. And so it was important for us to recognize that there is a need to understand the diverse identities of individuals, as well as the need to really underscore that there is a need for anti-racist policies and representation in the workplace, and that this is crucial both for the working experiences of Black mental health care workers, but also of Black youth receiving services. And so some of the solutions that we heard from participants were to advocate for mandated policies that target systemic barriers and promote equality for Black women within these care professions, to implement workplace audits that really ensure that policies and practices are actively enforced within these workplaces, to scrutinize recruitment processes to identify and address any potential biases against Black women, both entering the profession, staying within the profession, and moving up within their profession. And organizations should also note that they need to cultivate supportive workplaces where Black women mental health care workers can really discuss openly their challenges and their individual needs to be able to provide the level of care that Black youth need. And then lastly, there's a need to address the underrepresentation of Black mental health care workers to ensure that all youth receive the effective mental health care that they deserve. Thank you.
So now we have some time for a few questions. Are there any questions for our presenters? Thank you.
Hello. Okay. Thank you for that. That was very eye-opening. I have a quick question though. To see when you mentioned Black women mental health workers taking on multiple roles, I wonder if you looked at gender and that impact on this specific factor.
When you,
as in, would it be the same for a man, Black mental health worker taking on multiple roles? Just wondering.
Yeah, no, it's a great question. So we did have Black men in the original sample. So we had the original sample from Pathways to Care, and then we went back into it to look at the experiences of Black mental health care workers. And our original intention, we've worked on this paper for a long time. Our original intention was to look at just the experiences writ large across mental health care workers, regardless of their gender. But, you know, the information and the data was so salient for the experiences of Black women mental health care workers that became the focus of the paper. Black men did have very unique experiences that were different. One that I can think of was, you know, there was like a feeling of aggression, especially within the workplaces. I remember there was a Black male psychiatrist that talked about feeling that, you know, other people assumed that he was like angrier or more aggressive than he was. So there are like very varied in terms of like gender presentation and like the let me think of the right word. There is varied experiences based on gender. However, I would say that when it came to taking on multiple roles, that was something that was specific to Black women in the sample.
Do we have another question?
Thanks, guys. Great work. And it's really interesting to see the themes and kind of similarity to some of the things that have happened before. And I guess just thinking about the outcome and the results that you've got, and I'm sitting here just thinking, what's next? Because obviously, you know, and once again, congratulations for getting this work out, because part of that is disseminating it. But oftentimes we know that, you know, the sad stories and the sad quotes that people are talking about there, that, you know what, just for my own sanity, I have to leave this job, go elsewhere. You know, and obviously that's survival things, because ideally, you know, you're in a job, you want to stay in a job, yeah, but you have to leave because, you know, there's nothing supporting you. And I guess that represents stories of many people that, you know, end up leaving their dream jobs because they're not helpful. Have you guys thought about how maybe through this work you might think about what needs to be done to help other women and or others to navigate this really, really challenging and toxic environment without almost like having to then decide to leave? Because I'm thinking right now, you know, do people know legally what the employment rights are and how to navigate that? Or, you know, is there anything that you're thinking about as a package where there's a practice guide that can be available for women to tap into and know how to navigate the healthcare, HR, and or support networks that can really support them to manage this difficult challenge?
Thank you. That's also a really great question. I think the answer is always advocacy, and that's something that we do a lot of at Black Health Alliance, although we haven't done advocacy in this respect specifically. But I also think that a lot of, you know, the themes and the things that happened to participants was really because they were isolated within their workplaces. A lot of the participants talked about, you know, building community and building strength in numbers, and having that kind of support led them to do more advocacy, because I think they do advocate quite a lot for themselves, as much, at least they talked about that in the sample. And so it's really about building these structures where Black women in the sector can convene with each other, discuss, debrief, but also find ways and avenues to really push forward the fact that these are real experiences within the sector. Because I think that many mainstream organizations are relying on the fact that people are treating these as individual and isolated experiences rather than collective ones.
Thank you for your questions, and thank you for this amazing presentation. Just because of time, we're going to move on. But if you have any other questions for the presenters, you can find them at the end of the presentation. So yeah, another round of applause for them.